parent of a child with mental health issues. Zachary came to us with a broken arm, bite marks, cigarette burns, and more. His head was so bruised up that they thought he was a black child. Despite this, he was full of spirit. We clicked immediately. I remember he used to hit people with his cast, and he acted out a lot. He couldn't sleep unless I was there next to him. But things got better. Every piece of progress was a glimmer of hope that things were going to be okay for him and us, but they weren't. They aren't. Early life adversity and neglect, especially during critical times when children form attachment, have long-lasting impact. Add to this lead poisoning, head injury, early exposure to drug, and you realize that the hand this child has been dealt is not such a good one. To top it off, children who find themselves in these situations, like Zachary, they have a strong genetic load for neuropsychiatric disorders. To put it simply, these children face incredible difficulties. Most people understand this. They get it that people with this type of background have a long way to climb. They get it that they act out. They get it, or should I say, they got it when he was young. But as Zachary grew older, what was acceptable as a young child became unacceptable to many. He should be over it by now, they say. They're usually very sweet, sympathetic, and supportive at first, but then, as things get harder, they abandon ship. I mean, why wouldn't they? It's not an easy ride, and people need to put boundaries and to protect themselves, so they quit. And we're left alone again, having to deal with things that are bigger than us. We are left alone, or even ostracized. We are the parents of the bad kid, those who aren't strict enough and allow misbehavior. I smile. They're well-intentioned, perhaps, but they're clueless. They have no idea what mental illness looks like. We have tried so many things. Some work, but some really don't. I remember a partial hospitalization program where Zachary was locked up in a small room every time he misbehaved, so he would learn, so he would be held accountable for his misbehavior. But what did he learn? He learned that he is helpless and that he gets punished for his disability. So what keeps us going? Well, it is each other and Zachary himself. He's amazing in so many ways. And then there are all the healthcare providers. They haven't left us. They don't promise a solution nor a magic bullet, but they still help us and they try to relieve us from everyday difficulties. Without the support of these healthcare providers, we'd be drifting. I am so grateful they are there. But these are trained people. The others? Well, I wish they started seeing mental illness for what it is. An illness, not a choice. An illness that people would rather not have, but it's there. Let's help people heal by supporting them, not by punishing them. Thank you.